Ovarian disorders, specifically a neoplasm, um, usually there are different tissues within the ovary, and most of the tumors are benign and they can occur, especially in premenopause women. The characteristics of the mass and the age of the patient are very important factors in order to guide the diagnosis and the treatment of ovary neoplasm. The risk of a malignancy for an ovarian cyst is 13% in a premenopausal woman versus 45% in a postmenopausal woman. In a premenopausal patient, usually we use CA125 as a diagnostic measure. There are other markers also in order to pursue an early diagnosis of malignancy. Sometimes it is an imaging studies that discover incidentally the ovary mass. The cyst within the ovary should be evaluated by ultrasound. Any mass that enlarges and has changes in character, especially in a postmenopausal woman, should be explored surgically. We do have mainly three types of ovary tumors. One that is going to be histological formed by epithelial cells located in the membrane of the ovary. Most of the epithelial tumors are serous type, followed by endometrioid, and then mucinous, and then clear cells. The second type of ovary tumors are born from the germ cells. They're called the germ cells tumor, as you see inside the follicle. And they are dysgerminoma, York-Salk, and choriocarcinomas. And the third one derives from the sex cord and stroma. And the subtypes are granulosa theca or sertoli lady, depending on the type of cells that compose them. The epithelial tumors, as I told you, account for approximately the majority of the tumors in the ovary, 60 to 80%. They are several types: serous, mucinous, endometrioid, clear cells, transitional Brenner's tumors, stromal tumors with an epithelial element. The basic thesis explains the similarity of epithelial of the upper genitalial canal, endocervix, endometrium, and endosalpinx to those found in the ovarian tumor. So they have similar epithelium. Most tumors can arise from the epithelium and proliferate and degenerate into malignancy from specifically the surface of inclusion of a cyst. The epithelial tumors are classified based on their histologic appearance. So, serous type epithelial neoplasm can be found at any age of presentation, in younger patients, in older patients. They can have molecular mutations, CRAS or BRAF. The vast majority have mutations in the TP53. Serous tumor usually are bilateral. Mucinous tumor, the molecular alteration basically is CRAS mutation, and the mean age of presentation is going to be 50 years. Um, we've already talked about that. So, epithelial tumors, 90% of all are going to be malignant. Primary ovary tumors in germ cells, and it's usually presented in older patients. Germ cell neoplasm of the ovary are 95% benign. Mature teratomas, most of them are diagnosed in children and in young adults. And the sex cord stromal tumors are present at any age. This type of tumor can occur uh, at any age, although they are more common in postmenopausal women. But they're very rare. They only account for 2% of all the ovarian tumors. Histological, they are filled with lipid-containing cells similar to Ateca cells, and the tumor is known to produce estrogen. Oftenly, this tecoma, sex cord stromal tumor, presents with dysfunctional uterine bleeding or postmenopausal bleeding. They are rarely, but they're bilateral and they're rarely malignant. The tumors can range from non-palpable to very big tumors.